Hello everybody, so now we're going to be talking about weight gain in pregnancy. This is the topic of STEP2CK world. So weight gain of pregnancy or in pregnancy. The the whole understanding here is you have weight gain in pregnancy because you have a new individual growing up inside you, inside the body. So that weight gain of pregnancy kind of reflects the weight gain of the fetus, which thereby implicates that the weight gain of pregnancy is low. The fetus is definitely not growing properly. Or if the weight gain of pregnancy is more, that again implies that there's probably the fetus growing too bigger, maybe implicating macrosomia. So for this to make some sense, we need to know what is a normal weight gain of pregnancy. Now, to get that understanding, let me give you a preface of it, and the idea and the understanding here is weight gain of pregnancy is to be seen in conjugation with pre-pregnancy BMI. So whatever was the pre-pregnancy BMI of the patient, we are supposed to look at that and then come to a conclusion of what a healthy weight gain is for the fetus to be healthy. And here are those different values that we need to be worried about. LBS is something we won't be worrying about here. We'll only talk in kgs. So any female who comes with a BMI less than 18.5, which is underweight, is supposed to gain weight of, let's keep these values simple, from 13 to 18. And any one who comes from a female weight BMI 18.5 to 24.9, which is considered normal, the weight gain should be from somewhere from 12 to 16 kgs. That is throughout the pregnancy. If it's a little overweight, BMI 25.5 to 29, the weight gain has to be from 7 to 12, and BMI above 30, which is pretty overweight, which is obese patients, should gain somewhere from 5 to 9. Now, what is the rate of weight gain? The rate of weight gain can be remembered from lower weight is going to be, underweight people should gain more, which is around 0.5, and then you can keep subtracting 0.1 from there. Now, what else you need to know here are the implications of not gaining enough weight during the pregnancy or gaining enough weight. By the way, also a female needs to up her calorie intake from 250 to 450 calorie per day during second to third trimesters to kind of compensate for the needed weight, because this weight has to come from somewhere. The increased weight has to come from somewhere, and that has to be fulfilled by the female by upping her calorie intake. Now, if the patient does not take enough weight, if the gain is low, what are the complications that can have? So in a low weight gain in a pregnancy will give rise to low birth weight gain. So low birth weight in the fetus, in the newborn, and the second is going to be preterm labor. So the understanding here is the body is not able to supply the child, the undergrowing fetus, with enough calories, so the body tries to throw it out. That's just a way of remembering it. So the body is trying to throw out because it's not able to supply the weight enough nutrients. That happens when low birth weight. More gain of pregnancy weight can actually mean it could be gestational diabetes mellitus, fetal macrosomia, and because there is fetal macrosomia, you'll have cesarean section in the patient. So this is what you need to know about weight gain of pregnancy. What are the ideal weights, and what if you're not following them ideally? Thank you.